So you just change the point of view, but you don't make the problem with the right solution. And what came before the overweight? I heard about my patients, and I try to really have a time with my patient to hear what they have to say to me. And the amazing is that most of them has the same feeling. They have bad feelings, they have low self-esteem, they are unhappiness, they have incapacity to deal with the right food, they have fear to not lose weight, and they just think, I'm fat, I'm not going to gym today, so I stay home because I am ashamed. And they start to eat and eat and eat, and after day by day is the same thing. So they not change the mind. So it's a mind problem. They are craving for sweet, though they eat more and stay like a circle that never ends. The most of people, they have the desire of a miracle drug or diet. There is bulletproof, Atkins, soft beach, ketogenic, a lot of things. Each day you can see a new kind of diet that's something very miracle, but I really do not believe on this. The obesity is very easy to treat, but not the patients. Deepak Chopra, I have an opportunity of doing some studies and to know his work, and he has something that I really believe. All the disease is treatable, but not all the patient. And I can see clear this in my office because my mother has 3 cancers, and the doctors say to her that she just has 2 months of life, and she just say, I want to see my grandchildren born and live, and like she's like 16 years after cancer, she has no cancer. And other patient with just a myoma, she just said to me, I know that surgery will not go with the right way, and she stayed like 3 days in the UTI. So the mind control everything. Improving quality of life. The patient has to see that there is a way to follow. That's not the way that he tried about a lot of pills, a lot of drugs, but improving quality of life. The body is our temple, so you have to know how to take care about it. And the weight is not so important as we think about. Here you can see the muscle and the fat. It's the same, 5 EBs. It's the same weight. See the size of this muscle and see the size of the fat. So when the patient begins to lose weight, when he see the weight in a conventional machine, they don't can see what part is muscle and what part is fat. So to separate this is really important to understand how is going the treatment. So I do the bioimpedance that you can describe what is fat, what's muscle, what's water, what's bone. And the laboratory test, I do a lot of laboratory tests in my patient. I try gluten test in the measure, I do lactose intolerance, I do vitamin D, vitamin B12, vitamin C, I do serotonin levels too, I do insulin postprandial. In Brazil, our bigger meal is the lunch. So I always do the insulin post-lunch because actually in obesity people, it's very easy to find this very high that makes the insulin resistance that helps to become worse in obesity. And I do lactose and gluten intolerance too. And I also do the image of liver thyroid ultrasonography. And in the most of my patients, I have steatosis, that is fat on liver. Here is the machine that I use in my office, so you can see how is the body mass, how is the metabolism, how the fat mass she has to lose, 5.5 here is in kilos. How is she has to gain